During the pandemic, many cities around the country have seen increasing violence, with shootings in Boston up this year by about 30%. Even long before the pandemic, communities most affected by the violence have been trying to break the cycle by healing trauma. That's the central mission of the Louis D. Brown Peace Institute. To tell us how that mission's being pursued in a very changed world is the Institute's founder and president, Chaplain Tina Chéry. Thank you very much for being with us, Chaplain.
Thanks for the invitation, Chris.
Chaplain, I want to start with what many of us are going through right now, and this is not just the usual mix of violence and trauma, but we also have COVID-19 tangled up with that. What's that like for you?
You know, for us, it is challenging, yeah, because our mission is clear: to serve as a center of healing, teaching, and learning for families impacted by murder, trauma, grief, and loss. So what this has done is really challenge us to live that mission, because while we're dealing with families still whose loved ones have been murdered or are coming out of prison because of the decarceration with lack of resources, it's even challenged our mission to expand, because we are also dealing with those families whose loved ones have died due to COVID-19 with no resources to assist them to bury their loved ones with dignity and compassion. So it really has, really shown this light that, again, families in urban settings, poor, colored, Black, Latino, are disproportionately impacted. What this COVID-19 has done is really exemplified that, again, we are impacted even more. And when homicide hits, all resources shut down, because everything is now going for food and for assistance and everything else. But when death happens to a family, as a society, we are still lacking on how to best respond effective and equitable for that family.
In normal times, when there's an act of violence, a family has to react with a ritual of grief, get a funeral going. Nowadays, that's a lot more difficult. How do you help people with that?
You know, again, with everything, our partnership with the City of Boston and the Trauma Response Team, when we're in community, regardless of what happens, again, I always say, as poor people, we make things happen. This epidemic, it's not shocking to us, because we will serve people who need to be served. So our advocates have been creative, are working with families online, virtual, to really first provide emotional support to them, validate the feelings that they're going through, and then at the same time, now beginning to help them prepare to bury their loved ones with dignity and compassion. Whether they die on the streets or they die at the hospital, those referrals are made to us through the frontline responders that are there. Our advocates will reach out to the families. They will set up a time via Zoom, and at the same time, working with the neighborhood trauma response team to make sure that the family understands who is there to serve them. And for us, this is the guide that we use. The Survivors Burial and Resource Guide is that tool. So even if that family is not coming to us at the hospital, if they die at the hospital, the violence intervention advocates will make sure that the family receive the burial guide. They will then ask the family permission to give our advocates the family's phone number, and then our advocates will call the families to begin to bury their loved ones with dignity and compassion. So all of our hospitals, trauma 1 level, have this burial guide as a tool.
Even beyond the grief, at least the ritual of grief, you have other needs for these families, because they've been traumatized just by surviving what happened. And if they're still living in the same place where it happened, what does that mean?
It just means that we as a city need to do better with our citizens. That homicide, survivors of homicide victims still is not seen as, as a social service issue. It is still not seen as a public health issue. It is still not seen as a mental health issues because when we talk about victims and homicide, it's always about the victim. We still don't see that the families impacted by homicide are dealing with substance abuse, can become alcoholics, are suicidal, or are homicidal. And so resources are really not available to them. And that's why for the past 26 years, our goal is really to work with the city for an effective homicide response protocol and then transform the way we as a society responds to families of murdered victims. They're not just dealing with burying their loved one. That's the main thing. Yet at the same time, these families have had social issues even before they come to us. They're dealing with living in developments that are re-traumatizing. Shootings are happening every night. They're dealing with the fact that now COVID-19, they're not working. They can't work. They want more than food delivery. They need to pay their bills. They need to pay their rent. So that's what we find ourselves now providing financial assistance to a lot of these survivors who, again, as a society, we don't know they exist. So there's still a lot of work that we need to do as a city, and working with the city of Boston and with the mayor's office, being led by our Health and Human Services Chief Marty Martinez, to really make sure that Boston, in its language, in its portfolio, in its larger vision, provides a homicide response protocol. We are what's the word that I want to use? An example to the rest of the country. The rest of the country is looking to us because right now, the Anti-Violence Coalition in Philadelphia purchased the burial guide to make sure all of their members that are working with families of murdered victims are equipped with this tool so families can bury their loved ones with dignity and compassion. And that's what we want to do here. The hospital have it. We want to give it to the neighborhood trauma response team. And we also are working with our police commissioner and the family resource officer to make sure when they're making that death notification, that family understands what their rights are and who is there to serve them. So it's bigger than just responding to death. It's bigger than just having family come and stand at a press conference and do a rally. It's about a systematic approach. This is a human right approach. I know we talk about racial issues and social justice issues. This is a basic human rights that we have not touched on.
Well, in another part of your mission, in a way, is to be an intervener to break the cycle of violence. Given the challenges we're facing right now, is there anything new that you think people should be doing to break the cycle?
Well, it's not what people should be doing, Chris. I wanna exemplify people are doing. People in our city are really doing. I think what happens to me is that we choose who we want to promote. We choose who we want to bring out. So when I hear people should be doing more, it's like a knife that is stuck in my heart because we don't take the time to take inventory, to understand and to find out who is serving, who is working at the initial, at the prevention, in the schools, teaching peace through literature, equipping the teachers with the tools that they need to teach the value of peace to our young people, where they can begin to heal. In addition to math and reading, how do we teach peace? There are those that are working with those that are in between. They can go right or left. And then there are those that are working with reentry. So it's looking at the public health approach in order to interrupt cycles of retaliatory violence. Intervention must happen at multiple levels. And we still live in a society that is about police, prosecution, and prison. So we have to begin with our legislator and our city of Boston. We have to be able to now go on the other end and put education, prevention, possibilities, peace, and healing. So we need to invest the same way we're investing in the after fact, we need to do the same investment in the prevention, in peace, and in healing. So we need to talk to our legislators. Peace needs to be a city line item. Peace needs to be a state, a federal line item. The same way we want to release people from prison, we need to make sure that before they're released, the families of the victims and the families of those that are being released have the resources that they need so that when the person is released, that mental health aspect is a part of that. So we're still a reactionary society that we want to advocate to release. But then we're a society that's advocating for children to go back to school. So we want to release people out of prison and we want to push children to go back to school. It doesn't balance. Our priorities are still not in sync.
Tina, one thing that probably has not changed because it's been practiced by your organization for many years, and that is that survivors heal themselves by helping other survivors heal. If people want to plug into that some more and find out more details, is there a way they can do that?
There is a way they can do that. They can go on our website, ldbpeaceinstitute.org. The other thing that we're doing, due to the Mothers Walk for Peace, that as you know, for the past 24 years, we've been trying to raise our goal of 400,000. We exceeded this year. And, just want to thank everybody for their support in making it happen. One of the things we're doing is we're donating peace play kits. I don't know if you know this part of our work, but peace play is a healing modality where, again, a picture says 1,000 words. It's like, I call it a 3D vision board. You are the architect of your own inner healing. That happens when we provide a space, a containment, and without judgment for you to begin to heal from whatever. And the trauma happens before death knocks on our door, because we live in a society that tells us we live in hot spots. So peace play in urban setting is one of those modalities that we want to give about 100 peace play kits to community-based organizations, to families, and then September 21st, International Day of Peace, we really want to hold a virtual peace play in urban settings communities so the rest of society can see people in urban settings, families impacted by murder, trauma, grief, and loss. We all have the innate ability within us to do what we need to do so that we can begin to heal. And through the Survivors of Homicide Victims Network, which is led by Danielle, our coordinator, there are a lot of survivors that are doing amazing work. Legacy lives on. Let the healing begin. Denise works with families of homicide victims and families of those whose loved ones are incarcerated. Ruth Rawling does an amazing job, is working with some families of those young people that are pulling the trigger quietly so that we can add their voices to the forefront, that we don't want to wait for them, for their children to end up dead or in prison for murder, for us to react as a city. So all of these groups are going to provide peace play kits for them so that they can begin to heal, because we can't bring them here, they can't come here. And again, counseling in the traditional way doesn't work, for me anyway, as a Black immigrant Latina woman, this traditional counsel in America doesn't work for me. So this modality of playing in the sand with miniatures that represent the world has really given me the opportunity, how do I begin to heal in a society that does not understand or provide a space where healing is? Well, unless I was white, then really the resources will be there. So the Peace Play Kit is one of the things that we are really working on to distribute, and I hope we can work together when we're ready to distribute the kit. People can just call us, send an email, Tina, I would like a kit, your name, your organization name, or your family's name. And the only thing we're asking people to do, you would have to come and pick it up, sign a form, and be a part of this Peace Play virtual community so people can see the amazing power, the people of Boston, the survivors of Boston, or families on both sides of homicide, how we are informing, influence, and impact the public policy here in our own city.